Hello and welcome to Facebook Live with Dr. Bree. Today I am talking about a new and wonderful addition to our Healing Pathways Big Picture menu. As many of you know, we've been talking a little bit about our Healing Pathways programs. Each of them offers a deeper dive into how to have truly preventative holistic primary care. That's our expertise, and this is a test that's really exciting that we added a couple of months ago but hadn't really gotten around to telling our members about yet. So here you go. What is it? Galleri Cell-Free DNA, a multi-cancer early detection test. That's a lot. So basically, this is what my patients have always asked me for when they could say in the past, don't you have a blood test that looks for cancer? And now I can say, yep. Yes, I do. And this is it. So that's really exciting. It's 2024. This is obviously new and new technology, but it's really wonderful technology in the setting of detecting cancer early. So I'm going to tell you a little bit about what it is today and go into the nitty-gritty on it. I apologize in advance. You know how I always like to talk about biochemistry, but today we get to talk about statistics. Even more fun. I actually really like talking about biochemistry. Statistics, not as much, but that's okay. So I want you to understand a little bit about my history with this test and how I came to understand its well-being, or how I came to understand that it's here and what it can be used for. And I know that I'm often an early adopter, but I was even slow on the uptake on this one because I thought to myself, our practice is so small. I'm going to get this kind of test and hopefully nobody's going to be positive. And then if I have somebody with a positive test, which we'll talk about what that means, what am I going to do with them? How am I going to convince hematology or the cancer doctors that I'm not crazy? And now it turns out that those cancer doctors also know that I am not crazy and that this is a good test to do. So now everybody is on the bandwagon, not everybody, but a lot more people than were a couple of years ago when we first heard about it. So the next time I heard about it was when I went to the North American Menopause Society meeting last fall, and the subject of the meeting was personalized cancer care for the menopausal patient. And the speaker was an oncologist, a hematologist oncologist, a cancer doctor, and she was talking about a study in the United Kingdom using this technology with 140,000 people in the United Kingdom healthcare system. They're doing a 3-year prospective randomized trial using this for primary screening, which is a huge trial, and that will be really fascinating when those results come out. There's also several studies going on in the United States, including hopefully some studies that will help us get some insurance coverage for this test, because of course right now it's typically not covered, which of course we'll get to that also. It's still worth it in my mind, absolutely still worth it. So the speaker at the North American Menopause Society meeting got my attention when she was talking about the false positive rate, which is super low. So of course that's a concern, right? When it comes to any cool test or screening test, we want to know, well, what are the chances that a positive is a true positive? So the false positive rate is 0.5%. So that means the specificity, here's our statistics, the specificity of this test, which is, the chances that a negative test really means that the person has no cancer cells in their body is true, right? So the specificity is 99.5%. False positive rate, therefore 0.5%. The speaker said that what they're seeing is even in those false positives, if they follow those patients for 2 years, eventually, in many cases, it will show up in screening tests. It is possible that this technology is allowing us to find cancer so early that it's just in the DNA fragment form floating around in your bloodstream, and it's too early to even be seen yet on our imaging technology that we have today. That's when I thought, wait a minute. You mean those false positives might not be so false anyhow? That means I should start paying attention to this. And then, of course, I read the book Peter Attia, Outlive, and he does a great job going into this in his book on page 174. And I think that it's good to hear a little bit about his perspective. If you haven't already read this book, there's a whole chapter in here about our challenges with diagnosing cancer. He talks a lot about, the horsemen of our time, like the diseases that can get people that we can prevent. And of course, one of them, well, not prevent necessarily always, but what can we do in this paradigm that we're in now, medicine 2.0, he calls it, to get to medicine 3.0, where we approach certain diseases or chronic diseases differently. And cancer is one of them. In fact, there's some really interesting cancer statistics here that I wanted to share. Only 5 cancers have recommended screening tests. Only 5. Breast cancer, cervical cancer, colorectal, lung, and prostate. So that's not very many. Most of the cancers, especially the dangerous ones like pancreatic and ovarian cancer, those ones do not show symptoms until it's too late, until people are at stage 3 or stage 4, or until the cancer is what we call metastatic in places where it's not supposed to be. And when cancer is detected in those later stages, it's really hard to employ some of the effective treatments that we do have, because then it's, as they say, too late, unfortunately. Finding cancer early actually increases the 5-year cancer-specific survival rate by 4 times. So that means if you can detect it earlier, we can have much bigger impact on this process. A few more statistics. I did not realize that the cutoff age is about 50. So before 50, about 1 in 3 people will develop cancer in their lifetime. Adults over 50 are 13 times more likely to have cancer compared to those under 50. So that's why the test is indicated starting at the age of 50. And it certainly is indicated in anyone with a family history of cancer or a strong family history of cancer. Sometimes we find folks that come from families of multiple generations of different kinds of cancer. That's always the most concerning. Smokers, of course, are at increased risk for cancer, and anybody with a known cancer syndrome or kind of risky genetics. The other piece is if you've had cancer before, the chances of having a different cancer later are higher. So those are all people who qualify as at risk for cancer. That's when this kind of test comes into play. So what is it? Of course, it is a cell-free DNA test. What does that mean? Well, I think many people here have heard about NIPT testing when somebody is pregnant and they want to look at Down syndrome risk or genetic risk for the fetus. They do a blood test and then the doctor says, oh, your risk for Down syndrome is this or that, right? That's been pretty standard of care for over a decade. And what happened when they were doing these blood tests on moms that were pregnant, they were looking for cell-free DNA that was from the fetus in the bloodstream, and they were finding it, and they could then detect and run tests on what that DNA was coding for in terms of genetics. They could look at, trisomy, which is Down syndrome. And now we consider that standard of care. In fact, if your NIPT testing comes back positive for Down syndrome, the chances are very, very high, like 99%, that your baby will have Down syndrome. So it's very accurate, and it has really, cut down on a lot of the procedures we used to do to try to figure this out. Much more accurate technology. Well, it turned out while they were running these blood tests on moms, sometimes they were finding these other cell-free DNA fragments that were not related to the fetus but were abnormal, and they couldn't figure out what that was. What was that abnormality? It turned out some of those moms had cancer, and this was DNA that was fragmented DNA in the bloodstream that they could then track back to cancer, and they started to do that with regard to looking at the methylation patterns on these DNA fragments. So they're just little fragments of DNA that float around the bloodstream. They can detect them and tell from the methylation pattern if that DNA is likely to come from a healthy cell in your own body or an unhealthy cell in your own body. Because cancer cells have a totally different life of replication and methylation and DNA structure, and we can actually see those changes and say, wait a minute, this one doesn't look normal. Then they compared that with a massive AI engine to a database that helps us to understand the methylation pattern. If it is coming from an abnormal cell, what cell line it can be predicted to be coming from. So when you have a blood test with Galleri, what happens is you get a result that says no cancer signal detected or cancer signal detected. So no cancer signal detected, good. That means that it looks like there are no fragments of DNA in that sample that are coming from a cancer inside of your body. So we consider that a negative test. Now, it's not guaranteed that there's not a cancer brewing somewhere, but it means that none of that was not detected in the test, which is great. So the positive tests will come back as cancer signal detected. And then they have to give us a prediction for the physicians on where that cancer signal might be coming from. So it will say something like head and neck or uterine and ovarian. And then we have to utilize diagnostic testing to go looking for that cancer. So the blood test itself just is a screening test for multiple cancers, about 50 different cancers that they have matched in these databases. And if one is positive, they predict one or two regions where it could be coming from. Then we have to talk to the patient about going on a cancer search. But now we know that we're actually on a cancer search and we need to take a look around and do traditional imaging like CT scans, ultrasounds, that kind of thing, to try to go find where this cancer may be coming from if it's there. Not everybody with a test that is positive is going to end up having cancer. Of course, that's what we just talked about. There's a false positive potential. Now, it's important to understand what it looks like that if you have a positive test, right? And of course, that's going to worry everyone. So that's where, I always ask all the important nitty-gritty questions. What is the positive predictive value of the test? So that's another statistic. So we have our sensitivity and our specificity. So we talked about the specificity is 99.5% specific, false positive rate 0.05. Now, the sensitivity looks at something totally different, so we'll look at that one next. But the positive predictive value is the probability that a patient with a positive is going to end up having cancer, right? So that positive predictive value for this test is about 44%. So 44% of people who end up with a positive will end up with a cancer seen on imaging. Now, interestingly, we think, that doesn't sound great. But if you look at the traditional positive predictive value for our standard screenings, like mammogram, if you have a positive mammogram, the chances of then being diagnosed down the road with a breast cancer, it's only 4.4% positive predictive value for mammograms. We get a lot of people who are called back for mammograms who end up having diagnostic testing and don't end up with breast cancer, which is great. Cervical cancer, positive predictive value, 1%. Colorectal screening with the blood test in your poop, just the basic colorectal screening, 6.9%. And lung cancer screening, 6.9%. So 44% is actually a huge improvement, statistically speaking, in our world of early cancer detection. So that's actually really good news in my medical statistics brain. The thing that is most important to me on this test is the fact that we actually have a tool now to detect some of the most dangerous cancers that we haven't had a tool to detect before. So that's a graph. I'm going to put in a link to the company's website. They are not paying me to do this talk. I'm just telling you about how amazing they are because they're amazing and it's a really cool technology. We're not the only clinic that has it. You can find this all over the United States on their website for clinic providers that do engage with them and offer this test to their clients. So I'll link their sensitivity for different cancers. But what I want to highlight is that, there are really dangerous cancers. About 2/3 of cancer deaths in the United States are from cancers that we don't screen for and we can't predict and we can't detect very easily until it's too late. So that sensitivity for being able to detect a cancer in stages 1 through 4 is 76.3%. So in medicine, sensitivity is how well a test can detect a specific disease like cancer in people who actually have that disease. So that's really great sensitivity for a test like this that is relatively so new. There's even some where it's even more specific, including the head and neck cancers, esophageal cancer, pancreatic cancer. All of those ones are much, much higher detection rates even than that. So I will put a link to the sensitivity by cancer type because often people come to me with cancers that are very dangerous, like pancreatic cancer in their family. And I want to do everything I can to be able to detect early because if we can detect those cancers at stage 0 or 1, when they're just showing up on imaging, we have a much better chance of using the tools that we have that are really getting quite specific. We have some great tools to treat cancer now. It's just that we can't implement them until it's too late in so many cases. So that's a huge benefit of this test in my mind. So how it works. we talked about how to blood draw. It's 2 tubes of blood. 2 weeks later, we get results. We let you know if the cancer signal is detected or not detected. If it's detected, again, it talks about places it could be coming from, and then we go on the diagnostic testing search with imaging. There was a study that showed that, they could detect cancer about 364 days before it was present. It's something around that. And that's why it's recommended as an annual test at this time for people over 50 at high risk for cancer and smokers especially, or people who have those genetic risks for cancer. That being said, I think eventually we'll see that this is the type of test that in somebody who's low risk, we don't actually need to do it annually, but again, there's a lot of studies going on with this type of technology, and certainly we'll see that this is not the only company that is the player in this space as time goes on. And hopefully we'll see insurance coverage one of these days. Of course, we're always hoping for that. It's not outrageous when you talk about like the treatment for something like pancreatic cancer or the difficulties of going through treatment for esophageal cancer. Very near and dear to me, a patient who died this time last year from esophageal cancer in 6 weeks. And it was terrible because there were no signs of it until the oncologist literally said it looked like somebody lit a match inside of his chest. It was just awful. There was cancer everywhere, and there were literally no signs of it beforehand on imaging. Like, it was insane. So when we see cancers like that, of course, as a physician, I want to have every tool that I can to prevent that never happening to one of my patients ever again. That cost both emotionally is high, and also from a medical cost perspective is super high. So when we look at the cost, we have to put that in context. The test is $949 pretty much everywhere. We charge a handling fee on all of our specialty labs, and then we have a review fee if the cancer cell is detected. If the signal of origin is positive or the test is positive, then we have a review fee because we have to have extra time to go into what to do about it and what the next steps are, and really breaking that down. We like to spend a lot of time with our patients, so all of our Healing Pathways programs have that review fee tucked in there because we know that our patients like the extra time when we take deep dives to explain things. So we will be hopefully offering this test to our non-members at some point, perhaps. It's a little complicated to do so because, of course, if something comes back positive, I want to make sure you're in really good hands. So we'll have to have like a consult fee in that case that's a little different. So we'll have all of those details nailed down by our party in September. We're having an 8-year birthday party and health fair, and Galleri will hopefully be there with their own phlebotomist to do blood draws for our members. So if you want this as part of your wellness visit screening, if you want this at our birthday party and health fair, just save the date for September 26th. It's a Thursday. We're going to have one of our fabulous and famous parties. Hopefully it's not right before a global pandemic like it was in 2020. We're back to being able to celebrate without worry, hopefully. And that's pretty much all I have to share today on the Galleri cell-free DNA testing. It is multi-cancer early detection testing. It's really for people who want to be proactive. What it's not is a replacement for standard screening. It certainly is not there. It's still important to get your mammograms and colonoscopies and use the standard screening test, but this is an additional tool for people who want to be proactive, for people at high risk, for people who can handle the information if it turns back positive, and they want to make sure that they, catch things as early as possible. So that's what we're about. We're really about preventative, proactive primary care, and this is one of our new tools. I hope you have a great day. Send any questions and comments, and I'll put some links in there too, including a couple videos about how the technology works if you want to geek out on it. It's really super fascinating. So fun to practice medicine in this age. All right, have a great day.